The World Health Organization is calling for widespread testing for COVID-19. Meanwhile, the CDC says not everyone should be tested, and North Carolina is following that guidance. Michael Hyland reports.
Even if you think you're sick with COVID-19, the CDC and the state now say patients with mild symptoms and who are not high risk should just stay home and not seek testing. I talked about that Friday with State Health Director Dr. Elizabeth Tilson.
Is that guidance in place because it's necessarily the scientifically, medically best thing to do, or is it a recognition that we simply don't have the resources to test everybody who might be sick with this?
So there's a lot of different things that go into that recommendation. And for people with mild disease that will recover at home, a test is not going to change their management, but will increase that risk of spread. Second, yes, we do want to be mindful of preserving that personal protective equipment and those supplies for when and if we do get a medical surge, we're going to need to have them in place.
An analysis by the North Carolina Medical Society predicts with 3 months of social distancing for peak hospitalizations to happen mid to late May. That's the orange color on this graph. The red is a more dramatic spike with limited action. As of Friday morning, just over 7,000, or about a third of the state's hospital beds, are empty. For ICU beds, it's 724 empty, or about 22%.
The stay at home is exactly to flatten that curve, because what we want to do is not have everybody get sick at the same time.
What exactly has to happen in the next couple of months for you all to feel like we're at the point that we could start reopening schools and reopening businesses?
What we want to be seeing is now a deceleration of people accessing our hospitals and a deceleration on those testing positive from our sampling.
She says the state will monitor if there's any resurgence of the disease in the fall, and if social distancing measures will be used then, too.
That was Michael Hyland reporting. The Republican Senate leader is calling for a random sample of testing to better understand how widespread the virus is.